Bismillahirrahmanirrahim. Excellencies, ladies and gentlemen, I speak to you as a mother and an educator from the Maldives who has witnessed through all of my years of service the very real and detrimental impacts of mental health issues on people. Traditionally in the Maldives, mental health issues were not acknowledged, let alone spoken of. It is one thing to ask for help when you know what ails you, or when you can see a physical symptom, but is entirely more complex when you do not have the words to explain and you don't know whom to turn to. Over the last few years, the Maldives has taken steps to develop mental health services across the country. The National Mental Health Strategic Plan aims to ensure inclusive and effective psychosocial support measures, including expanding the National Universal Health Insurance Scheme to cover mental health illnesses and the establishment of a National Mental Health Center. How essential these initiatives are became especially clear during the height of the COVID-19 pandemic. Psychosocial support provided by the National Emergency Operations Center was a lifeline for many. Ongoing global crises such as conflicts, the rising cost of living and climate change continue to inflict serious levels of anxiety and depression for many. Mental health support is more crucial than ever. It must be taken extremely seriously. Yet, the WHO's status of mental health report released recently states that mental health systems all over the world are marked by major gaps. In the Maldives, we are limited in how many mental health professionals we have. It is even more of a challenge to provide quality services to a population that is dispersed among so many islands. Recruitment is limited, waiting lists are long, resources are shifted to short-term crises that require immediate responses. Preventive care and early interventions are transformational in mental health care. This requires systematic changes which enables mental health to be accepted and treated as we would treat an individual who has suffered a sprained ankle or has diabetes. Psychosocial support must be accessible, affordable, and available to all. Where there is collaboration with the wider family, educators, faith leaders, social workers, and community, the level of support for those struggling with mental health issues is strengthened. Strengthening mental health services leads to a stronger society. Removing the stigma leads to greater numbers of people seeking help, staying in school, getting treated, and learning to continue in their careers and live. In my role, I have the privilege to engage with mental health professionals and those who seek their care. I know how difficult access is. I welcome the opportunity to use my voice to advocate for systematic solutions. These include greater financial investment in mental health services, inclusive access, more research, and ensuring that a strict code of ethics is maintained by practitioners. We are making progress, but I do believe learning from others and collaborating will be key to further success. The strength of the Commonwealth has always been its ability to give an equal platform to nations of every size. Using opportunities like this event, I am very eager to hear more about the challenges in other countries and to learn what has and has not worked in your communities. I'd like to note a common sentiment expressed during the launch of the WHO Mental Health Report, that is, on the acceptance of mental health and building an empathetic community. These are values I could not agree with more. Excellencies, before I conclude, I would like to thank the Government of Bangladesh, the Government of Rwanda, and the Suchona Foundation for giving me this opportunity to say a few words on a topic so close to my heart. Thank you.